I think is relevant here. So this patient, she's had 2 early stage TNBC. So right breast in 2018, and then it sounds like a second primary because it was at early stage in the left breast in 2021. So she's completed her treatments, including an immunotherapy. It sounds like doing fine now, but she wants to know, do you recommend any like ongoing treatment she should be on, or just any other ways that she can help herself try and reduce her risk of recurrence?
That's a fantastic question, and I'm happy to hear that you're doing so well. The first thought that comes to mind is one of the indications for hereditary genetic testing is developing a bilateral breast cancer. Also, any diagnosis of triple negative breast cancer of any stage warrants genetic testing for BRCA1 and BRCA2. So it's an opportunity to say, make sure you have your genetic testing that can answer the question, why did this cancer develop? It can also suggest if a BRCA1 or 2 mutation is present, whether there's risk of other cancers like ovarian cancer, and screening for that would be different and intervention might be different. I would say that one of the other opportunities in this place, when you're done with all of the typical breast cancer directed therapies, would be to think about wellness and complementary approaches. So I think I mentioned a little bit earlier that postmenopausal women who receive a bone-directed therapy, zoledronic acid, have been shown to have better breast cancer survival. So this applies whether tumors are triple negative or hormone receptor positive. So I would say if you are postmenopausal, it's reasonable to get a bone density and to talk with your doctor about the role of using zoledronic acid. It is something that is in ASCO guidelines, right? That important cancer organization that I mentioned. And that zoledronic acid is given twice a year for 3 to 5 years. It helps strengthen the bones, but it also helps reduce the risk of breast cancer recurrence in bone and improve breast cancer survival. And then outside of that, there is a lot of research going on lifestyle interventions. And this is a place where I would say it's important to be cautious, evidence-based. Be sure you're checking in with your care team and your physicians about whether interventions are safe, because many people will be out there mentioning certain restrictive diets or supplements that they're recommending you take. And the evidence is really quite limited in what actually has benefit. So we do know that trying to follow a diet that is a little bit more plant-based and minimizing meat, not necessarily excluding, but just minimizing and helping to maintain a healthy body weight is going to be beneficial for breast cancer. We know that weight-bearing exercise is important. It is helpful for bone strength and cardiovascular health, but there's a big research program going on around the country looking at how a certain amount of exercise in a given week can impact breast cancer outcomes. There is a body of evidence around alcohol consumption and how that actually is somewhat toxic and can increase risk of breast cancer. So we recommend moderation and trying to stay below 5 to 7 alcoholic beverages per week on average over a lifetime. So this is another place where I would encourage exploring potential clinical trials, because although when we think about trials, we're always thinking about chemotherapy or exciting new drug development and targeted therapies, there's a huge amount of investigation out there in complementary therapies, lifestyle interventions. And if it's something you're interested in, I would say pursue it in a clinical trial so that the entire breast cancer community can learn from this. There have been trials looking at acupuncture, which actually were randomized studies that proved certain acupuncture techniques helped minimize the joint pains and arthralgias and aches that came from anti-estrogen therapies. And if that study was done with the same rigor as investigational new drugs, and that helps us go to insurance companies and say, this is an intervention that really works. You need to provide care for our patients and cover this service because we have the data to back that up. So an encouraging plug there for thinking about those non-therapeutic but interventional studies that can really advance the science and help support women with breast cancer.
Yeah, that's fantastic. I've personally heard in my own support groups and things, women really having success using some of those therapies, just to
Mhm.
feel better, right, and to get themselves through
Right.
treatment or recover faster. And so, and I
Yeah.
do know, I hope this becomes more and more common, but some of the bigger academic cancer centers will even have a integrative oncology center that is a part of the program. And
Right.
that is such a huge benefit because it's a really safe place to be able to explore those additional integrative therapies.
Absolutely. I would say for a minute, so I work at Memorial Sloan Kettering in New York City, and we have a huge integrative medicine group that really has funding and support to do these kinds of trials and also maintains a website through Memorial called About Herbs that you can look up different kinds of herbs and supplements, and it will share out what the data is that we know, where there might be some concerning contraindications. And the pandemic, one of the silver linings of the pandemic was really driving digital and virtual platforms like this to offer education and deliver care and deliver services. So even if you don't necessarily have an academic center in your backyard, explore some of the bigger centers may have virtual services that you could avail yourself of.
About Herbs is so helpful. I can't tell you the number of
Yeah,
people I know that use it. It is so.
good.
I will put that in the blog post for everybody listening when we summarize.
Great.
You can have direct access, but you could just Google About Herbs and Memorial Sloan Kettering. It is
Yeah.
a phenomenal service for any
No,
supplements or other things that you're
right.
considering taking, and any indications it might
Right.
have the therapies that you're on, or just
Yeah.
in general if it's a bad idea.